So I just gave them some furosemide, so some common side effects for that since it helps with your hypertension. That might be like some dizziness, nausea, vomiting, maybe some abdominal cramps. So if you have any of that, please let me know. And your next medication is going to be guaifenesin. And this is going to be your liquid medication that helps with your cough or common cold symptoms. So when you are preparing this, you want to make sure you get down at eye level. And you want to make sure that when you take off the cap, you lay it down heads up so you don't get like any bacteria or anything in the cap. And you want to make sure that you put your palm against the label when you're pouring it so nothing drips over the label so that like make it smear or anything like that. So again, get it down at eye level and get the right medication dosage. And this is going to be for your cold symptoms. So again, some common side effects might be some dizziness, nausea, vomiting, abdominal cramps, anything like that for your oral medications. So sorry if it tastes kind of a little bit off. Thank you. All right. And the next medication is going to be cobalamin, which is going to be for your vitamin B12 deficiency and pernicious anemia. So this is going to be your sublingual drop. So what you're going to do is you're going to put it underneath your tongue, and I'm going to let it sit there and let it dissolve. So don't drink anything with it. Don't obviously you can't chew it or anything like that. So I'm just sticking it underneath your tongue. And you just let it sit there for about 10 minutes, and this is going to help with your vitamin B12 deficiency. Yeah. So again, some common side effects might be some nausea, dizziness, vomiting, anything like that. So let me know if you experience any of those things. And then now we're going to do your nicotine lozenge, which is your buccal medication. So this is going to be stuck in the back of your mouth in between your cheek and your gum. And again, you're just going to let this dissolve, so you can't drink anything with it. Don't chew it, don't swallow it. Just let it dissolve for about 10 to 15 minutes. And this is going to help with your nicotine withdrawals. So some common side effects of this, if you do experience this, let me know. Some tremors or nervousness, dizziness, anxiety, like anything like that, nausea, vomiting. So here you are. Just let that sit in the back of your mouth and let it dissolve for about 10 minutes or so. All right. Now we're going to move on to some eye drops. So if you could lay down for me. The first one we're going to do is Timolol, which is for your glaucoma. So we're going to stick this in your lower conjunctival sac, and it's going to help with your glaucoma and how I'm going to administer it is I'm going to take my non-dominant hand and I'm going to open his eye and make sure that it's open and hold him stable so like it doesn't drip out of his face or anything like that. So I'm going to put it in the lower conjunctival sac. And again, this is for glaucoma, so any side effects you might experience, some itching, maybe a little bit dizziness, anything like rash, like let me know if you have anything like that. And then your next eye medication is going to be your eye ointment, which is called ciprofloxacin, and this is going to be for your conjunctivitis or your pink eye. And again, this might cause like any sort of like itching, rash, and again, I'm going to take my non-dominant hand to hold, keep him stable and to open his lower eyelid, and I'm going to take it from the inside out, and it's going to be in his lower eyelid again. Go in and then out. And making sure I'm holding up open his eyelid so it doesn't like soup out. And again, let me know if you have any itching, rash, anything like that, because that will be helping your pink eye. Now we're going to do your nose drop, so if you can see me laying down for me, this is going to help with nasal decongestant or nasal, it's going to like help with your nasal congestant and pressure. So again, let me know if you have any like nausea, vomiting, dizziness, or anything like that. If you'll lay down back on your back for me. Now I'm just going to stick this into the nose. This is a nose drop, but you don't have to inhale or anything because it should just absorb. Lay down there. And again, it should help with clearing up your sinuses for your nasal decongestant and stuff like that. All right, now I'm going to move on to Debrox, which is your eardrops. So if you could lay down on your, it's going to be in your left ear, so you can lay down on your right side, so facing this way. Sorry, I'm moving you everywhere. So this is for hearing loss in the left ear. So I'm going to stick this in his left ear and make sure I pull his ear up and back, or yeah, up and back. Put it in. Rub his tragus, make sure that it absorbs. And again, common side effects of this, you might get a little bit dizzy because like it's in your ear, and you might experience like moderate hearing loss for a bit of time, but it should disappear within a certain amount of time, like maybe 10-15 minutes or so. But just let me know if you experience any, like maybe you have itching or dizziness, anything like that. Okay, now we're going to move on to nitroglycerin patch, which I'm going to do on here. So before you do this, you have to make sure this nitroglycerin patch is for like moderate to severe chest pain or hypertension. So before you administer the patch, you want to ask them, obviously, if they've had it before, and you want to make sure that there's no piercings, no rashes on the place where you're going to apply it. There's no like hair or like anything like irritated skin, because you want to make sure that like they don't get irritated by this patch. So what you're going to do is you're going to check the dosage, and usually it's about ½ an inch or so. You're going to take that and you're going to put it on here, about ½ an inch. You're going to stick it right here. You're going to take gauze and put gauze over it, and you're going to make a picture frame with tape and put it around the gauze. And then after I apply it, obviously, since some common side effects might be like